kick off. Welcome back to the 1760 sessions where we talk to founders building systems with impact. I'm Harry, as you all know, from 1760 Strategic AI, and I'm joined today by Stephen Adams, founder of Simple Health OS, a behavioral platform bringing daily health insights to the masses at a small price a month, if I don't mind saying. Stephen spent 7 years building Tiger Medical Institute in the preventative medicine space before making a huge move and a huge pivot to something probably more scalable. And we're here to talk about it today. Stephen, thank you so much for being here.
Thank you, Harry. I'm excited to share with your audience.
Awesome. So the big first burning question I had to ask you is what made you essentially walk away from Tiger Medical after I think it was around 7 years to start something like Simple Health OS?
Well, I haven't walked away. I'm just not putting the full force of my energy behind it. It's an established, proactive lifestyle medicine medical
Yeah.
practice and very, very ultra niche oriented around founders who have exited. And we continue to do that. So what Simple Health is a logical extension off from that and saying, what have we learned over the last 7 years that we could apply to something that we can scale, but yet maintain some level of personalization. So that's where the Simple Health idea came from.
Okay. And how do you intend to scale Simple Health where you maybe couldn't have scaled Tiger Medical as well?
Yeah. On the Tiger side, part of the difficulty of scaling is it's a premium service with
Yeah.
premium pricing. And there's just, there's a segment of the world that can afford it and two are willing to pay for it. And so by definition, that is an ultra niche. And
Yeah,
I'm
yeah.
okay with that. But I saw over the last several years how people were getting better. And one of the things that our two clinicians said was, Steve, if they just did our health habits, all of them would get significantly better, even without a doctor. And that's what spawned the idea was how can we approach populations of people and basically help them bring their own medicine to their life and get 1% better every month. And so that's really where the idea of Simple Health came from because it's ultra simple is the concept.
So we've touched on both the organizations. Sorry, just for people new to listening to us, can you
Yeah.
just give a high level of overview of what each Tiger Medical and Simple Health does? That would be awesome.
Yeah, right. Well, Tiger Medical is a proactive, preventative medical process. It's a system that we sell that somebody comes in and has a one-to-one relationship with a physician and a one-to-one relationship with a board certified health coach. And it involves extensive testing in multiple realms, utilizing a type of medicine called functional medicine, which analyzes all of the body systems, not one at a time. It's a health span expanding process, not a lifespan. Health span, meaning the number of years that you're healthy. In the US, the statistics are the average person lives to about 78, but they only have a health span until age 66, and then they're sick for the last 12 years of their life on average. And what we want to do is compress that gap and have less sickness and shorten the amount of time that they're sick. So that's Tiger Medical. So that is a highly personalized, customized, curated, guided process, one-on-one with real clinicians. What I wanted to do is go, what can we do to bring a lot of the lessons from Tiger Medical to the masses who are not going to invest thousands and thousands of dollars on that one-to-one relationship? And so we are within about a week or two of actually launching our MVP, our minimally viable product, where we integrate a facial scanning technology with our health habit coaching with a behavioral change philosophy all in one. Like the three-legged stool is behavior change, health habits, and scanning. And the real concept behind it is how can we get people at scale to modify their behavior just enough to improve their metabolic health. And just so you know, this whole platform is really built exclusively around metabolic health. We're not trying to solve autoimmune or some rare disease. We're trying to focus on what 85-90% of people get sick with, which is cancer, hypertension, diabetes, or cardiovascular disease.
And you know what? I think your products, both of them, are super relevant now more than ever. A lot of people, particularly in 2026, and a lot of the media that I see out there at the moment is all about how can I change my life for the better. And you see a
Right.
lot of people investing in things like aura rings, people investing in whoops, and they come at a cost and they come at a premium. And I think something that's accessible more than ever, well, is accessible to everyone more than ever, has a chance to completely fly. So I'm excited to see the journey that you go
Yeah.
on, and it's definitely something I would like to be a part of, to
Well,
be
you
honest.
will. What we learned over the years is just data alone, like everybody, if you have an Apple Watch or even on your phone, there's the Apple Health app,
I'm obsessed with it.
right? And there's Aura and there's Whoop. But a large percentage of our customers at Tiger Medical said, that's great, but I don't know what to do with it. And so that's where the Simple Health app comes in, is that we know there are core habits that will address the things that are in your wearable device information. But there's a lot of people, Harry, that just don't want to spend the money on a wearable device. They don't want to wear it. They don't want to maintain it. They don't want to try to remember to charge it. People lose them. I've lost 4 Oura rings because my fingers
Yeah.
shrink and they don't do half sizes. They only do whole sizes, and I'm a half size. So I either get my finger choked off, or I get or it's too big. And so the idea behind this was we wanted to empower people with something everybody has, and
Yeah.
that's a phone.
And do you know what? This is such a relevant conversation in my household alone right now, just because I had a whoop and I stopped wearing it so much because I didn't know what to do with all this data telling me that I was tired all the time. I knew I was tired all the time. Furthermore, I don't wear watches, and I get people wear watches. I don't really like having something around my wrist, so then that
Right.
then became a pain. So I chose not to renew my subscription. Then my partner loves the Aura ring, and it fits in with the jewelry that she wears. But we've always been back and forth about sizing. So we've just
Yeah.
come back from holiday, as you know, and it was this worried tension around, is it going to fall off in the sea? And then
Right.
naturally in the heat, your skin kind of expands, so it then fits her better. And it's such an ongoing conversation. Is there a scope to maybe integrate the data from both Simple Health with something
Yeah.
like Ring?
Yeah. So what we're doing right now, our initial product will be very basic, and it's going to be just you can scan on your laptop. And
Yeah,
then we're going to have what's called a web app, which is nothing more than our website on your phone with a little logo so you can tap it and then do the scan. But while we are releasing that and getting user feedback, our team is also engineering the native app, which will have full functionality,
nice.
and we expect to release that in April, early April. That's going to have up front, it'll have the Apple Health app and the Google Health app integrated right in. And then over time, we're going to add Aura and some of these other devices as well. So, yes, it'll have both.
Very, very cool.
Yeah, right. But what I'm trying to do is we're going to be, so we will certainly be available like on our website, simplehealthos.com, where a consumer can get it. I'm going to market it through networks. So I also have an organic grocery store with 13,000 customers, and I'm in a nationwide association in the U.S. with 600 plus stores, and I'm going to market to that whole association. That's my goal. We're primarily a B2B play. We're going to be selling to employers to embed into their
Yeah,
fit programs to lower their healthcare costs. And then we're working on securing some pilots in the government paid healthcare space with poor populations and elderly populations where they don't have the tech savviness or maybe the education.
yeah.
So we're building the platform where it'll work for people like that. Because at the end of the day, Harry, what we are is we're a behavioral change company. We're not a tech company, but we're a behavioral change company.
I recall we've had a call before this, and I recall you saying it's other companies are focusing on that cool tech side of things, whereas you're more trying to actually make a difference. So that leads me on to what is the bigger mission you're pursuing beyond this, beyond the tech, beyond the subscriptions?
Yeah, well, the bigger mission is human flourishing. When people feel better and they're the best version of themselves, they show up better for the kids, for their spouses. They may have a dream inside their head that they can't bring out because they're so sick they can't do it. So that's the big idea. I'm a big believer in the concept of the Jewish term shalom. It's so much more than just hello. It's thriving, flourishing as a person, and becoming and living into everything you can be. I read a great book by a guy named Jim Murphy called uh, Inner Excellence, and I adopted a phrase out of his book. Like, my whole purpose in life personally is to raise the level of excellence in my life to learn and grow in order to raise it in others. And part of that is their health journey.
That's a fantastic philosophy. And I've actually taken a mental note of this, Jim Murphy. I will be
Yeah,
happy
inner
to look to read.
excellence.
Yeah, after this call, please remind me the name of the book because I'd love to look into this further.
Oh, it
Um,
is. Yeah, yeah, definitely.
I'd love to dive into sort of the business model and the growth vision. So I understand, you're targeting $10 a month. That's mass market. You've just spoken about all the different avenues you can go down, and it almost feels like it's endless, which is awesome to see. And that's mass market. And you're not just helping people who are paying for a premium Tiger Medical, you're going beyond that. I recall from our last conversation, you have some fairly ambitious targets which I think were achievable, definitely. So it was
Yeah.
around 1,000 users by March, 10,000 by the end of 26, okay, in 3 years. Walk me through how you're going to get there.
It's all going to be networks. The And we could blow those numbers away if we execute our strategy
Yeah.
well. Um, I'm a big believer. I'm going to shoot another book at you now. It's called The Science of Scaling, um, by Benjamin Hardy.
I'm writing this one
And
down.
yeah, and his concept is impossible goals with impossible deadlines. And the reason you set them is that it's a forcing function around clarity. And so our actual internal team goals are 1 million users in 3 years. And so what that does, Harry, is it forces us to go, how in the world could we possibly get to 1 million in 3 years? Well, number one, we can't be customizing the app for every Tom, Dick, and Harry that have a different vision.
Yeah.
We gotta have a my CTO calls it a modular construction so that we can embed into different systems. And so we're going to get there by selling government health systems and employers while we allow the consumer to buy it. But it would be very difficult to scale to 1 million consumers with a consumer strategy because you're
Yeah.
competing with all these famous people out there like Mark Hyman and Peter Attia and Andrew Huberman and Ben Greenfield and Dave Asprey and all of them. We don't want to do that. We want to come in and help because in the US at least, and our strategy, Harry, is global. Like, we want to sell this globally. The primary problem that employers and governments have globally is usage. There's just too high of usage of the healthcare system because people are living such horrendous lives in terms of their habits and the types of things they're eating.
Um,
And so, yeah, what's helped us, Harry, is whether you like him or not, Robert Kennedy, the director of Health and Human Services in the United States, has created this whole new conversation around preventative medicine that has not been had in this country ever. And when I got into this space pre-COVID, it wasn't on anybody's radar. And then everybody got disillusioned by healthcare and COVID, and now people are much more open to alternative medicine.
yeah, 100%. And it's very interesting. I had someone on the podcast not too long ago talking about they work for one of the biggest weight loss clinics in Chattanooga. And we were talking about how different regions and different countries respond to healthcare and it's different problems in different locations. And I think as yours isn't, it's kind of more, you want a level of personalization, but there's also going to be a level of one size fits all per region, I can imagine. We spoke largely about the US and the fact that there's the obesity problem, whereas there's not much access to transport, so everyone's having to drive everywhere. People are sat down the whole time.
Right.
And there's a huge level of, I think, customization you can do for each different market that you approach, definitely.
Yeah, well, and that's, with our employers and government, we will probably have a little bit higher pricing because of the customizations.
Yeah.
But even just a little bit higher is a bargain compared to the solutions that they've been using for the last 25 years. Uh, but one thing, we know, everything we've used at Tiger Medical, the protocols we've used are all rooted in the literature, so they're all evidence
Yeah.
based. And so we know, like, even if we forced everybody to do the first 90 days the same and then let them pick after that, the literature says we can improve their metabolic health by 30 to 50%
Oh,
just
wow.
in 90 to 120 days. So, and that's where that's a big chunk of the cost of healthcare is that people are so unhealthy. They don't move. They eat a lot of ultra processed foods. They eat a lot of sugar. They're not sleeping well. They don't manage stress well. Those are the biggies.
Okay. Look, it's absolutely fascinating. So let's talk about the operations today. And I remember you said something on our last call. It was something around we can't scale individual humans. Can you tell me more about that, if you recall the statement that you made?
Uh, I don't necessarily recall that, but the way the way that we're scaling this is by creating the simple health concept
Yeah,
because we can scan millions of people every day. The way the algorithms and the AI is built into the app or will be built, we'll be able to handle millions and millions of people at the same time. That's really how we can scale it. Yeah, I'm,
okay.
I'm not sure if I'm answering your question.
Yeah, you are. You definitely are.
My goal has been to eliminate operations, that the app does all the work,
Yeah.
that I need nobody in the back end of this thing doing something manually.
So that kind of does lead me perfectly into the sort of next question I had lined up, and that was, where does your team kind of spend most of their time in the back end, so to speak, at the moment?
Sure, good question.
And what do you wish you could have on autopilot, really?
We're not there on the autopilot yet, but so I have a marketing person who has a team in the Philippines. They're heavy users of marketing AI tools to automate and do a lot of marketing functions that used to take 4, 5, 6 people to do. So, for example, I have other companies that I record podcasts for now. And I'll start doing that for Simple Health
Amazing.
and where I either do a solo and produce content or I interview like a subject matter expert, say on exercise science. They're able to take that and use AI tools to break that down into dozens of blog posts and social media posts and all of that, all building our brand online. um, and for me, being a B2B player, I'm not trying to create necessarily a big funnel of people coming in through social media buying the app. It's more of the
Aware.
credibility and the brand presence for somebody who might look into us once they learn about us. So that's one area. Our CTO lives in Australia, and he's the one that is engineering this three-legged stool of integrating the facial scanning technology with our health habit protocols with artificial intelligence that in our first rendition of this when we go with version 1.0 even with the native app it's not going to be intelligent, it's going to be automated with AI. Then as we get more and more users on the platform it'll be training it to become more intelligent. So I mean, we're hoping by the end of 2026, it's has the ability basically to read a person's scans and go, boy, you really need help in this area. And by the way, we're concerned about you. So here's a link to Teledoc. We want you to meet with a doctor and get this addressed.
Okay, awesome. I love the usage of AI there. It's one of the key remits that strategic AI or 1760 helps people with, and that's the socially
Yeah,
generated
right.
content. And we have a tech VA out in the Philippines who is absolutely fantastic, one of the most switched on people I've ever worked with. And it's great to see that you're already utilizing that to move forward. But more importantly, having AI continuously improve your actual platform
Correct.
is where the key is going to be for you to progress and keep up with any changing trends. Um,
Yeah, I agree, Harry. Yeah, and that's why what you guys do is so important.
yeah, yeah,
Because you have to embrace it. You cannot run a business the old way anymore. Those days are over. And when I say those days, I mean a year ago.
yeah, yeah. And look, and it's we are at a pivotal time, and it's either move with AI or essentially get left behind, really. So I want to look at the scale and the vision because that is it's important. And I know we've
Yep.
already spoken about your growth plans in terms of where you want to be in 3 years. But what does scale done right look like for Simple Health in 3 to 5 years, so to speak?
Well, if I look out further, we're integrated into multiple government health systems across the world. We're servicing very large employers with tens of thousands of employees, and we've got the data proving that our approach to behavior change is driving a positive return on investment for these partners of ours, and that we have continued to make our platform more and more intelligent and actually bring real value to the user, to the person, because so that's really what it looks like. I am very focused on executing the process of getting us
Yeah.
there and less on the final outcomes. And I'm also obsessed with solving this problem of cost burden for employers and for government payers. And then the third obsession is just the actual user. My standard is we're not there until they literally cannot live without this.
Amazing.
Yeah.
And is that the last? So you covered a lot of the questions I had actually lined up. It's going to be around what's your North Star metric, but you're covering it as we speak. But
Yeah.
that final piece around you can't live without it. And do you think this maybe comes down to usability? Because we live in a world now where at the click of my fingers, I can book an Uber, click of my fingers, I can book an Airbnb, and we
Yep.
reuse these apps because of the simplicity. Is it going to
That's
be down to product and user experience, do you think?
Yeah, it is. It is. It's actually, I told Mike, my CTO, I don't want the most features of anybody out there. I'm not feature driven, I'm simplicity driven.
Yeah,
How can I want people I basically want people every morning when they wake up and they haven't eaten yet to go like this for 30 seconds. And then I want them to have insights. And then basically we're only having them work on one thing at a time. And
yeah.
they're building that into their behavior one habit at a time. And it's incredibly simple. I just see apps, they get all loaded up with features, and it's clear to me they're not talking to the users. We're going to
Yeah.
have an obsession with talking to users.
So it's almost like I like to think about it, crawl, walk, run. You know, you use one behavioral part of your platform, you see a change in yourself, and then it suddenly has someone has a light bulb moment and be like, right, what else can we focus on instead of trying to
Right.
give too much information at once? And sometimes this is why we live in a world where people scroll through short format content, and that's why it's important to have embedded into the app that less is more. Give someone
Right.
less information on how they can change, and then it will feed them in order to go and search for more. It's something that I
Right.
always think about.
Yeah, I agree. And also, it's caught more than it's taught. Over the last 7 years, what I've seen with our best clients that have done the best is they get a little bit of a win and then they get excited, and then we don't have to motivate them anymore. They just pursue it with a
Yeah.
vengeance
But this
because,
is
yeah,
this is what humans are like in everything. You
they
see
are.
what one time is for you in your own businesses, for me in my business, I see one bit of success and I want to keep going. And it's very natural. And it's when the success is more personalized to you. For example, you run your organization that's very personal to you. This is strategic AI is very personal to me.
Right.
And if it's something to do with a health change and you see a step change, it does get obsessive. And I think that's why a lot of people become gym obsessive or whatever it may be that makes them
Yeah.
continue to go down that path.
Yeah, I agree. That's a really good observation. And one of the things that I'm trying to do, this I'm going to turn 62 in March, and I'm the healthiest I've been in 25 years. I was bragging to my son, he works for a brain science company in Silicon Valley, but he is
Wow.
also a certified personal trainer. And I said to him, I bench pressed last this week more than I benched when I was 35. And he was just like, Dad, that's great. Keep going,
That's
because he's pushing on me to like get more muscle mass
yeah, yeah,
back
yeah.
before I get too old. But shoot, I lost track of where I was going with that.
I'm just impressed with hearing your bench press. I love to hear it. It's a fantastic story, and I think it's.
Yeah,
I've been encouraging my mother to exercise more and more. She has a PT because I want her body to be stable at an older age, and that's you only do
right.
that for up
That's
to
what it's about. That's what it's about. It's the balance because people
yeah.
die when they fall and then they get immobilized. And
Happened
then
to
it's,
my grandmother. She
yeah,
passed away falling, and I don't want to see that happen to someone else in my family because bones get so brittle, but muscles support bones. This is why whenever I'm in the gym and you see someone in their 80s in there with you, you're like, okay, all right. And
yeah, yeah,
then
yeah.
when they're embarrassing you, it's even worse.
Yeah, and that's the whole thing. One of my goals is I have two grandchildren, and I'm
Yeah,
able to get around the floor and roll around with them. They can jump on me. I can chase them around a yard. And I want to be able to do that for 25 more years. And so that's for me, that was my journey. I was very unhealthy running a big 9-figure revenue company that I started from scratch in the pet retail space. It about killed me. I didn't take care of myself. I traded ambition for I traded my health for ambition, and it was a bad trade. And once I got into this world, man, I just caught the vision and took off. And
Yeah.
so what I'm trying to do now at this age is go everything I've ever learned in business the last 40 years, what can I want to apply it. I'm not making the brand about me. I have a board chairman who I'm accountable to. Most founders don't do that voluntarily. I'm
Yeah.
bootstrapping it rather than bringing a bunch of VC money in because I think it forces better decision making early on when you don't have the money to throw at it. And the other thing is I'm really focused on rather than trying to chase every stupid healthcare trend out there and what's going to change, in designing this app, I'm asking myself what never changes about human nature and build it around what doesn't change. And what doesn't change is people hate change. They don't make new habits very easy. We're all basically lazy and we don't get excited about something until we get a win. And so behavioral science has proven empirically that you got to do baby steps. And so that's what I'm doing. I'm designing this around how we are, not how we aspire to be.
Okay. And that is probably the most positive thing to do. And also fundamentally, I don't think healthcare and people wanting to better themselves is ever going to change. I think just
No,
the struggle is targeting the market of people that need to change. And I
right.
think you've hugely covered that in the usability side of things. But it's amazing to see the learnings you've taken from the pet healthcare organization and the burnout that you probably faced and have taken that
That's what's
into
huge. Yeah.
launching the new business. And that's probably there's an element where probably a leaf out of your book that I could take.
Right. Exactly. Yeah.
So it's quite funny you mentioned. So what was the pet healthcare business in?
Well, it wasn't healthcare. It was pet retail. It was like
Pet retail,
is there something called pet home or home pet in England?
pets at home.
Yeah, it's just like that. It's
Okay,
a,
okay.
it's that in the US. There are some big box stores like PetSmart and Petco, and ours was I bought into a franchise. We were the third largest chain. We were the smallest concept, and it was very successful. And we were in 6 states. Um, we had almost I don't know 700-800 employees and
Wow.
a whole like almost 50 stores. It was fun. It was a 21-year, a lot of learning, a lot of
A
stress,
lot of
but
learning. It's got
it
to
was
be
good.
done to make you the man that you are today, bench pressing
Yeah,
probably more than me.
yeah,
Steve, look, I've really enjoyed having you on, and I'm looking forward to one using your product when it gets to
yep.
the UK because it's very exciting. And as I said, I've had problems with other solutions in a similar space, and I think what you're doing is fantastic.
Thank
I'm
you.
sure we could talk for hours about this, and just thank you so much for joining.
Oh, you're welcome. And if you want to follow the story, just go to simplehealthos.com. The
Awesome,
site is going to be launched probably this weekend. So by the time they actually hear this, the site will be up and running.
amazing. I'm going to put a link. I'll normally upload this by Friday, so the timing will be perfect, and I'll put a link in the description.
Okay.
Thank you, Steve.
Thank you, Harry.
Cheers.